So friends, we are coming to a firearm important topic. The flame produces. The flame produces burning and singeing of hair. Smoke produces blackening and gunpowder produces tattooing. Three effects: burning, blackening and tattooing by flame, by gunpowder and by smoke. Yes. Now we are coming to a very important topic: rifled firearm, contact shot, close shot, near shot, distant shot. In rifled firearm, in contact shot, muzzle impression present, and in all remaining shot, muzzle impression absent. The shape of the wound in contact shot, it is stellate shape, and in all remaining ranges, the shape is circular. Burning, blackening, and tattooing, which is caused by flame, smoke, and gunpowder, in contact shot, that goes inside the track. In close shot, burning, blackening, tattooing all present. In near shot, only tattooing present. Near shot, only tattooing present. And in distant shot, all absent. Abrasion and grease color present in all shot, like contact, close, near, and in distant. In all shot, abrasion and grease color present. So you can see the stellate shape in the contact shot. Yes. Burning, blackening, and tattooing, that will be in close shot. Only tattooing in near shot, and it will be all burning, blackening, and tattooing will be absent in distant shot. Just remember this very important concept. Now, sir, what are the tests for live birth? Because in live birth, respiration present. Radin test is a test of air in ear. Radin test. Fodre test, after respiration, lung weight become 30 gram to 60 gram. That is a twofold. So you can remember twofold Fodre test. Lung weight become 30 gram to 60 gram, twofold Fodre test. Block weight test, you just pick the P. Block weight test is a test of proportion of lung weight divided by body weight. Without respiration, 1 by 70. After respiration, it becomes 1 by 35. Block weight test. P for block weight, P for proportion. Twofold Fodre test, air in ear, Radin test. Breslau first life test and Breslau second life test. What is your first life? How to remember? तो याद कैसे करोगे? आपकी पहली लाइफ कौन सी है? Your first life is lung, so air entry in lung is Breslau first life test. It is also known as hydrostatic test, and air entry in stomach or intestine is a second life test, because your second life is like stomach or intestine. So what is your first life? Lung. Air entry in lung is a Breslau first life test, and air entry in stomach or intestine is a Breslau second life test. These are the tests for live birth. Now, viability of fetus is 28 weeks. This is the age after which fetus is survivable, is capable of survival outside. This is 28 weeks, or I can say 7 months. The age of viability is 28 weeks or 7 months. This is the age after which the fetus is capable of survival. Capable of survival. Now, sir, hangman knot. Hangman knot is used in judicial hanging. The ideal site is below chin. The ideal site is below chin, but in India, it's been put below the angle of mandible. Ideal site is below chin, but in India, it's been put below the angle of mandible. The hangman fracture is a fracture of C2 vertebra, that's axis vertebra, and it causes brain stem damage. It causes brain stem damage. This is a hangman fracture. Hangman fracture. Ballooning. Ballooning is a method of inhalation where we inhale the gas from balloon. Gladding is the method of inhalation where first we spray in the room, then we inhale. And huffing is a inhalation method by using some cloth. Huffing is inhalation by cloth. Gladding is spraying in the room, then inhale. Balloon or bagging, that is by balloon or bag. That is ballooning. Now, sir, there are two types of negligence. The one very important is civil negligence. Civil negligence is also known as tort. Second is criminal negligence. two type of negligence. Civil negligence is a tort. Criminal negligence is another negligence. Civil negligence is a mild negligence. Yes, my dear friend. Criminal negligence is a gross negligence. In civil negligence, the burden of proof, yes, my dear friend, the burden of proof goes towards patient, means patient needs to prove. In criminal negligence, burden of proof goes towards doctor. Here, punishment is compensation. You have to give compensation. But here in criminal, the compensation as well as 106 BNS. 106 BNS. That is a punishment for criminal negligence. Here it is in civil court or consumer court, civil negligence. Here it is in criminal court. Example, overdose of a drug producing side effect, that is a civil negligence. A surgeon left the swab in the body that can cause death, that is a criminal negligence. Or even I am giving one more example of the criminal negligence, like if you are alcoholic, you have consumed alcohol and you are doing some surgery and the person collapses, that is a criminal negligence. 106 BNS for medical criminal negligence. 2-year punishment or up to 2-year punishment. 106 BNS. Now, sir, very, very important word. Rape is defined under 63 BNS, that is a definition of rape, and punishment of rape is 64 BNS. How would you remember the punishment of rape? The punishment is 10 year to the life imprisonment, and you can remember 6 plus 4 is equal to 10 year. That is a very simple trick. 64 is the punishment of rape. Punishment up to 10 years, that is 6 plus 4 is equal to 10. Definition of rape 63 BNS. ओके, तो रेप की डेफिनेशन होगी 63 BNS और पनिशमेंट ऑफ रेप हो गया 64 BNS. 65 BNS when the girl age is below 16 and when the girl age is below 12, that is 65 BNS. Minimum age of a girl for giving consent for sex is 18 year, that is a part of 63 BNS. तो याद कर लेना, डेफिनेशन ऑफ रेप 63, पनिशमेंट ऑफ रेप 64 एंड अगर लड़की की उम्र 16 साल या 12 साल से कम है तो 65. चलो सर, थोड़ा सा गैंग रेप के बारे में पढ़ लेते हैं. G is the 7th letter. Gang rape, 7th letter. So gang rape is 70 BNS. G is the 7th letter. So the gang rape will be punishable under 70 BNS. 70 BNS. Postmortem staining color. Carbon monoxide poisoning cherry red. Cyanide poisoning brick red. डिफरेंस है थोड़ा सा. कार्बन मोनोऑक्साइड चेरी रेड, साइनाइड ब्रिक रेड, हाइपोथर्मिया ब्राइट पिंक कलर इन पोस्टमार्टम स्टेनिंग, हाइड्रोजन सल्फाइड H2S, so there will be two color, bluish green, opium black color. And now I am coming to pan. Your pan color is chocolate brown color. So here what is pan? P for phosphorus, A for aniline, N for nitro compound. Here color is chocolate brown. याद करने की ट्रिक बहुत आसान है. पान में आप खाने से आपका मुंह का कलर चॉकलेट ब्राउन हो जाता है. सो दोस्तों, हाइपोथर्मिया में ब्राइट पिंक जरूर याद रखना, एग्जाम में पूछा जाता है. दीज आर द कलर ऑफ पोस्टमार्टम स्टेनिंग. ओपियम इट्स अ ब्लैक कलर. हाइड्रोजन सल्फाइड देयर विल बी टू कलर, ब्लूइश ग्रीन. सर, सुपर imposition technique is a technique. Here we are using skull on the photograph of person. That is a superimposing of the skull on the photograph of a person. This is a screening technique. That is a superimposition technique. Sir, most reliable method, very, very important for criminal identification. I am putting a word, most reliable method for criminal identification is fingerprinting Galton system. Fingerprints are not inherited in the identical twins. This is a Quetelet rule. Fingerprint are dermal papillary ridges. Dermal papillary ridges. First fingerprint bureau in Kolkata in 1897. It was first used by William Herschel in 1858 and it was classified by Galton. How many points are the minimum point criteria for fingerprint? 10 to 12 points. And fingerprint in the fetus develops in the 12 week, completes in 24 weeks. 12 ones are 12, 12 twos are 24. This is fingerprint, the best method of criminal identification. The best method for decomposed body would be DNA. So this is a Galton system. Now, sir, this is the first variety of the fingerprint, loop variety. You can see it is formation of loop like this. This is a loop variety. In loop variety, we have one delta and one core. In loop variety, we have one delta and one core. And you can remember loop has OO, one core and one delta. O means one core and one delta. What is core? When the points merges or converges towards each other, that's a core. And the meeting point from three direction is a delta. So in loop variety, there's a one core and one delta. This is a most common variety is loop variety. This is a arch variety that is divergent. So in arch variety, my dear friend, there is no core, no delta. In arch variety, there is no core, no delta because there is not conversion, there is a diversion. In whirl variety that is making circle, there is 1 to 2 core or 2 delta. 1 to 2 core or 2 delta. Most common type is loop variety. Loop में double O होता है, 1 core and 1 delta. In arch variety, just like a mountain, no core and no delta. And in whirl variety, just like a circle, 1 to 2 core and 2 delta. That is another very, very important point. Friends, common witness is a witness which has a first-hand knowledge rule. If you have seen any crime, you are a common witness. फर्स्ट हैंड नॉलेज रूल इज ए कॉमन विटनेस. अगर आपने क्राइम होते हुए देखा है तो यू आर ए कॉमन विटनेस. Expert witness like a doctor or any fingerprint expert or chemical expert can go for volunteering of the statement. They can give statement voluntarily. That is an expert witness. तो दोनों सवाल आते हैं. First hand knowledge rule is a common witness and volunteering of the statement is an expert witness. Now, A killed B. C has seen the crime. C is a direct evidence. A killed B. C has seen the crime. C is a direct evidence. Now C told this story to D. D is a hearsay evidence. Now the third very, very important, A with knife came out. A with knife came out and E has seen that E is a corroborative evidence. Corroborative evidence is a indirect evidence. If you have seen the crime, you are a direct evidence. If you heard about the crime, you are a hearsay witness. And A came out with the knife and E has seen, that is a corroborative evidence, which is a indirect evidence. Now, sir, there are two type of very, very important word. Public prosecutor and public witness, same party. Defense witness and defense lawyer, same party. Public prosecutor and public witness belong to same party. दोनों एक ही पार्टी के. Defense witness and defense lawyer belong to the same party. Now we have three type of examination: chief examination, cross examination, and re-examination. Chief examination, same party lawyer asks you the question. That's a chief examination. Means public prosecutor asks question to public witness or defense lawyer asks question to the defense witness. It's a chief examination. Cross examination is by opposite party lawyer. Yes, my dear friend. Cross examination is by opposite party lawyer. Defense lawyer asks question to public witness and public prosecutor asks question to defense witness. So these are the cross parties or opposite party. It will be a cross examination. Re-examination is again by same party lawyer. So chief examination is by same party lawyer. Cross examination is by opposite party lawyer. And re-examination is again same party lawyer. Now, sir, if you see this bell-shaped flower, which is yellow in color, this is yellow oleander. It acts through sodium-potassium channel. This yellow oleander is Cerebra thwaitia, a bell-shaped flower, yellow color flower, pila kaner. It's a cardiac poison. It is a cardiac poison. It is acting through sodium-potassium channel. The botanical name is Cerebra thwaitia. इसको ऐसे याद कर लेना. हाथ पीले करना मतलब सेलिब्रेट करना. हाथ पीले करना मतलब सेलिब्रेट करना. इट इज ए सेरेब्रा थिवेशिया, सोडियम पोटेशियम चैनल के थ्रू काम करता है. इट इज ए कार्डियक पॉइजन. नाउ सर, this is afim or opium. This is a anticholinergic plant, dhatura, and it is also known as thorn apple. And these are the seed of dhatura. First is the picture of opium, afim. The fruit, you can say the unripe fruit. The second is the kantedar seed, that's a thorn apple, dhatura, and the seed of dhatura are seen. Now, sir, if you see, my dear friend, this is Dhatura stramonium, that is a thorn apple. And these are Dhatura seed. As I told you, Dhatura seed are anticholinergic. 100 seed are fatal dose. And the main anticholinergic is hyoscine. How would you remember? याद करने की बिल्कुल आसान ट्रिक है. H for 100 seed, H for the main anticholinergic is hyoscine. It is a deliriant poison and it is a 9D poison. Like dryness, drunkenness, diplopia, drowsiness, delirium. It's a dhatura. It is the most commonly used railway or roadside poison. The antidote of dhatura is physostigmine. So this is a very, very important plant. Dhatura, the anticholinergic, H for 100 seed, H for hyoscine. And main antidote of dhatura is, you can get a question, physostigmine. It causes delirium. That's why it's a railway or roadside poison. This question comes in exam. Blind as a bat, hot as a hare, dry as a bone, red as a beet, and mad as a wet hen. This is none other than dhatura. If these 5 lines comes in exam, you have to pick the line that is a dhatura. The antidote is physostigmine. Sir, this is another very, very important question. Aconite, meetha zahar or blue rocket. Aconite, meetha zahar or blue rocket, you can see the roots are conical shape and it is a cardiac poison. There is a classical sign, Hippus sign. It is also known as monkhood. Aconite, blue rocket, meetha zahar or monkhood. Sir, it is a cardiac poison and it causes hyperkalemia which leads cardiac arrhythmia. It causes hyperkalemia which causes cardiac arrhythmia. CA is cardiac arrhythmia. Very, very potential word. And there are 2 signs in the aconite. One is Hippus sign, the alternate contraction and dilation of pupil. Another, you can get a question, xanthopsia, the yellow colored halo. तो दोनों क्वेश्चन को ध्यान रखना, दोनों क्वेश्चन एकोनाइट पे आते हैं. There is a alternate contraction and dilation of the pupil, that's a Hippus sign, and that's a yellow colored halo, that is a xanthopsia. Both are seen in aconite poisoning. Now, sir, if these symptoms are given, that is pulse rate, BP, respiratory rate, everything you can see and pinpoint pupil, it is opioid intoxication. Now, sir, I am coming to a very, very important word. Opioid intoxication. One of the example of opioid or afim or one of the product of afim is a morphine. तो आपको जो opioid intoxication के feature याद रखने, you can remember by morphine, M for meiosis, O for orthostatic hypotension, R for respiratory depression. Very, very important. Respiratory depression, pain relief, histamine release causes bronchospasm and hypothermia. तो दोस्तों इसमें आपकी बॉडी का टेम्परेचर कम हो जाता है, दैट इज हाइपोथर्मिया. सो मियोसिस डन, ऑर्थोस्टैटिक हाइपोटेंशन डन, रेस्पिरेटरी डिप्रेशन डन, पेन रिलीफ एंड हिस्टामिन रिलीज कॉजेज ब्रोंकोस्पाज्म. इंक्रीज intracranial tension and infrequency of the urine. Nausea and naloxone is an antidote. It causes euphoria and sedation. If these symptoms are given, we are talking about opioid intoxication. But what are the withdrawal effect of opium intoxication? Yawning, insomnia, dysphoria, and dehydration. Yawning, insomnia, dysphoria, and dehydration. There is opposite, increased BP, increased heart rate, respiration, and secretion. And my dear friend, remember piloerection and mydriasis. Piloerection and mydriasis, the opposite of opioid intoxication. So अगर piloerection, mydriasis or increased BP, heart rate, respiration or secretion are seen, that will be, my dear friend, विड्रॉल इफेक्ट ऑफ द ओपियम। तो ओपियोइड इंटॉक्सिकेशन को याद करना तो मॉर्फिन याद कर लो, विड्रॉल इफेक्ट इसके ऑपोजिट होंगे, इसमें इंसोम्निया, डिस्फोरिया, डिहाइड्रेशन आर वेरी वेरी इंपॉर्टेंट। सर, फॉर टॉक्सिकोलॉजिकल और केमिकल एनालिसिस the most commonly used preservative is common salt, but the ideal preservative is rectified spirit. Most common is common salt, but the ideal preservative is rectified spirit. Now, other preservative, for blood we use sodium fluoride and potassium oxalate, urine toluene, same sound. Histopathological we use formalin, and virology we use glycine. These are special preservative, but for chemical analysis, the most commonly used preservative is common salt, but ideal preservative is rectified spirit. Ideal preservative is rectified spirit. Blood, sodium fluoride or potassium oxalate, urine, toluene, histopath, formalin, and virology, glycerine. Sir, motorcyclist fracture is also known as hinge type 1 fracture. This is hinge type 1 fracture. This is petrous sella turcica and the opposite sella turcica. This is a motorcyclist fracture. Depressed fracture is caused by hammer. This is a depressed fracture. Gutter fracture is caused by bullet that produces gutter. Diastatic fracture is sutural separation. Fracture surrounding the foramen magnum is a ring fracture. Comminuted fracture is also known as spider web fracture. Motorcyclist fracture is a hinge type 1 fracture. Hammer produces depressed fracture or signature fracture. Bullet produces gutter fracture, the oblique bullet. The comminuted is spider web fracture. Ring fracture is a fracture surrounding foramen magnum. Diastatic fracture is a sutural separation. The most common is sagittal suture. Sir, lucid interval is seen in EDH, and it is due to rupture of middle meningeal artery due to hitting at the pterion. Middle meningeal artery, pterion hitting is EDH, and lucid interval present. Medical negligence charge are very common in the EDH because if you are not able to identify lucid interval, thunderclap headache and xanthochromia are seen in subarachnoid hemorrhage. Biconvex hemorrhage is EDH, and concavo-convex hemorrhage is SDH. Lucid interval and medical negligence, middle meningeal artery and pterion EDH. Thunderclap headache and xanthochromia SAH. Biconvex EDH, idli shape, and concavo-convex SDH. Now we are coming to pedestrian injury. If you are walking and you are hitting, this is primary impact, direct hitting. This is you are coming over the bonnet, secondary impact. Tertiary impact, you are hitting on the ground. Tertiary impact, you are hitting on the ground. So you can see the primary impact is the first hitting, first contact that will produce bumper fracture of tibia bone. So first hitting over the leg, that's a primary impact that will produce bumper fracture of the tibia bone. Secondary impact injury, as I told you, you are hitting over the glass or bonnet, that is a secondary impact. Now next one is very very important, secondary injury, which is also known as tertiary impact. What is this? You are hitting the ground. If you are hitting the ground, there are two possibilities. Number one, multiple grazed abrasion or tire mark. These comes under tertiary impact or secondary injury. I am coming to the one point. Primary impact over the leg, bumper fracture of the tibia. Secondary impact, glass or bonnet. And a tertiary impact hitting over the ground, there will be multiple grazed abrasion and tire mark. Multiple grazed abrasion and the tire mark. The most common organ damaged by blunt trauma is spleen, by penetrating trauma liver, by blast injury tympanic membrane. Blunt trauma spleen, penetrating trauma liver, blast tympanic membrane. By seat belt, very very common injury is mesentery. But sir, another very very important organ to be damaged are hollow viscous like small intestine and spleen. Small intestine is very very common organ. By seat belt, there is a chance fracture or fulcrum fracture of lumbar vertebra. Blunt trauma spleen, penetrating trauma liver, blast tympanic membrane, seat belt, mesentery is very common, and hollow viscous are very common. And then seat belt produces chance or fulcrum fracture of lumbar vertebra. Now, sir, blast injury. My first topic is Marshall triad. Marshall triad is seen in secondary blast because of punctate abrasion, contusion, and laceration. Marshall triad is seen in secondary blast. Air compression produces primary blast, tympanic membrane. Flying missile, yes, my dear friend, flying missile produces Marshall triad in secondary blast. You are hitting the ground, tertiary blast, and burn and flame, quaternary blast. Marshall triad, flying missile hitting the body, abrasion, contusion, and punctate laceration, that is secondary blast. Air compression, primary blast, hitting the ground, tertiary blast, burn and flame, quaternary blast. Friends, defense wound. Defense wound can be of two types, active and passive. Active, when you grasp the weapon, you are defending your body and you grasp the weapon. So active defense wound are common on the palm and web surface. Passive defense wound, when you defend like this, extensor surface of hand and forearm. You grasp the weapon, active defense wound, and you defend like this. This is a passive defense wound. That is extensor surface of hand and forearm. Self-inflicted injury. Self-inflicted injuries are very common on the flexor aspect of the forearm. On the flexor aspect of the forearm. Active defense wound, palmar or web surface. First web space is very common. And passive defense wound is this. Self-inflicted is this. याद रखना दोस्तों, ये बहुत important है. Sir, mugging. What is mugging? Very, very important word. What is mugging? That is constriction by forearm and elbow. Judicial strangulation, which is common in Spain and Turkey. This is garroting. Judicial strangulation, that is common in Spain and Turkey. That is garroting. Burking is homicidal. I will let you know. बांस से डोला, बांस के बीच में डोला. बांस, that is between stick, you are compressing the neck. Overlaying is accidental. What is overlaying? Mother coming over the child. And burking is homicidal. What is overlaying? Mother comes over the child, overlaying. Burking is homicidal. This is mugging. Judicial strangulation. In India, we have judicial hanging. Judicial strangulation in Spain and Turkey is garroting. And my dear friend, between stick को हम बोलते बांस, बांस से डोला, बांस के बीच में डोला. So as you can see, this is burking. What is burking? Burking is a combination of smothering. Yes, as you can see, burking is a combination of smothering and traumatic asphyxia. Burking is a combination of smothering and traumatic asphyxia. This combination is known as burking. Sir, artificial bruise is produced by three plant PSM. What is this PSM? Plumbago, semicarpus, and madar. Dr. Saab, these are not a normal bruise. This is artificially you produce. So there will be positive chemical test. There will be regular and well-defined margin. There will be presence of vesicles. There will be itching and there is always a brown color. So what is PSM? Plumbago, semicarpus, and madar. Madar is a calotropis or akdo. There will be a positive chemical test, regular and well-defined margin. There will be vesicle, there will be itching, and it's a brown in color. That is a artificial bruise. Now, sir, if some injury is given that has a clean cut edges, crushed tissue, cut tissue, and disruption of vertebral bone, that is probably a chop wound because there is a crushing of the tissue, cutting of the tissue with disruption of vertebral bone, and chop wound is caused by X. That will cut the tissue, crush the tissue with bone fracture. That will be a chop wound. Now, sir, if you see some injury, listen very, very carefully, with ragged, irregular, uneven margin, with tear diverging at the angle and swallowtail. Tear diverging at the angle with swallowtail. And my dear friend, bleeding of the wound is not significant and showing crushed blood vessels and hair bulb. Crushed blood vessels and hair bulb. So, Dr. Saab, this is by a heavy blunt force that will produce the swallowtail, irregular, uneven margin with crushed blood vessels. आपकी blood vessel crush हो गई, hair bulb crush हो गया. This is none other than lacerated wound. Sir, Fish tailing is seen in stab wound. If you see the fish-like thing and with tail formation, this fish tailing is seen in stab wound. Irregular margin, crushed hair bulb, crushed tissue, less bleeding, and swallowtail laceration. Fish tailing is seen in stab wound. Yes, very, very important word. Sir, you can see the three type of burn. Number one is dry burn. Number two is moist burn. Number three is chemical burn. Listen very, very carefully. In dry burn, singeing and blackening present, sodening absent, blister present, red line present. So if these are the phenomena, that will be a dry burn. Yes. In moist burn, that is one of the example of the moist burn is scald. When do we use a word scald? When the temperature of liquid or steam is more than 60 degrees. This is known as moist burn. Scald is a moist burn. Here, if you see the feature of scald, no singeing and no blackening, sodening present and blister plus red line present. This is scald. Scald is a moist burn. तो दोस्तों ध्यान से देखना, ब्लैकनिंग, बर्निंग और सिंजिंग है, रेड लाइन और ब्लिस्टर है तो ड्राई बर्न, सोडनिंग है, रेड लाइन और ब्लिस्टर है, दैट विल बी स्कैल्ड. स्कैल्ड when the liquid or steam is more than 60 degree. In chemical or corrosive burn, no singeing, no blackening, sodening may be present, blister and red line both absent, but ulcer present. That will be a chemical or corrosive burn. Ulcer present in chemical or corrosive burn. So these are the three type of burn. Sir, this is a very important example. Pattern bruise. This is by lathi or rod. It is a tram line bruise. Butterfly bruise produced by pinching in battered baby syndrome. That is a butterfly bruise. 6 penny or coin shaped bruise are present in the throttling. So again I am revising, my dear friend. Lathi or rod produces tramline bruise depicted in the picture. Pinching the baby, butterfly bruise, that is seen in battered baby syndrome. ध्यान से सुनना. और 6 penny bruise present in throttling, coin shaped bruise. These all are the example of pattern bruise. Sir, ectopic or migratory bruise. Listen very, very carefully. Very, very characteristic sign of ectopic bruise is battle sign. Battle sign is in, battle is always in मैदान. Battle कहाँ पे होती है? युद्ध कहाँ पे होता है? मैदान पे. M for मैदान, M for middle cranial fossa produces mastoid bruise. So if you see the mastoid bruise by middle cranial fossa fracture, this is a battle sign. It's a middle cranial fossa fracture, bruise present at the mastoid area. That is a battle sign. So this is battle sign, a migratory or ectopic bruise. Sir, split laceration is also known as incised looking laceration. Split laceration is also known as incised looking laceration. It is seen in the skin which is very close to the bone, like scalp, chin, shin. So in these areas, scalp, chin, eyebrow, like this forehead, the posterior part of this elbow, the shin, in these areas skin is very close to the bone. So if we hit by some blunt force, it look like incised wound. It is known as incised looking laceration. So as you can see, this is the picture of split laceration, incised looking laceration. But sir, the opposite part, ये पक्का आएगा exam में. Opposite part is laceration looking incision. My dear friend, listen very, very carefully. Laceration looking incision. This is seen in axilla and scrotum. Laceration looking incision. This is seen in axilla and scrotum. Laceration looking incision, axilla and scrotum. Inside looking laceration, hard surface where skin is very, very close to the bone, like scalp, forehead and eyebrows. Now sir, in cobra bite, very, very important question sir. In cobra bite, we give anti-snake venom, neostigmine and atropine and mechanical ventilation. Why mechanical ventilation? The cause of death is respiratory muscle paralysis. So in cobra bite, we give neostigmine and atropine. Why atropine is given? To counteract the effect of neostigmine. So it is a neurotoxic snake, cobra bite. But sir, viper, V for viper, V for vasculotoxic, here bleeding is seen. The maximum local symptom and bleeding are seen in viper. So you can see in viper bite, what we give, anti-snake venom, fresh frozen plasma and surgical debridement is done. Now, karet is another neurotoxic snake where cause of death is respiratory muscle paralysis. But sir, Here neostigmine doesn't work, so no need to give neostigmine and atropine. Here anti-snake venom and mechanical ventilation is done. And my dear friend, Karate is also a neurotoxic snake, but neostigmine and atropine are not given. What is the right strategy for snake poisoning? That is, first is reassurance, second is immobilization, third is go to hospital and give proper history, and the fourth is give the proper treatment. This is the right word which is used for snake poisoning. R for reassurance, I for immobilization, G for go, H for हॉस्पिटल, फटाफट हॉस्पिटल जाना, प्रॉपर हिस्ट्री दो, आप बता दो कि भाई स्नैक कैसा लग रहा था, और T for treatment has to be taken. Remember my dear friend, neostigmine and atropine is given for cobra bite, and Karate, no neostigmine, no atropine, only mechanical ventilation and anti-snake venom. Now, this is king cobra. King cobra is also known as Ophiophagus because it eats snakes. Cobra is Nag, Naja, Naja. Nag, Naja, Naja. King cobra is Ophiophagus. How to identify by cobra? The hood contains spectacle. The hood contains spectacle, that will be a cobra. Cobra is Naja, Naja. King cobra is Ophiophagus. क्यों? क्योंकि king cobra सांपों को खाता है. That is very, very important. Both are neurotoxic. V for viper, V for vasculotoxic. As I told you, in Russell viper, this is a Russell viper. Russell with muscle. There is a 3 brown rows of scale. 3 rows of brown scale. That will be a Russell viper. Russell with muscle. Russell viper is vasculotoxic. That's why we are doing for anti-snake venom, fresh frozen plasma, and surgical debridement. Maximum local symptom. Now, sir, this is Karate, none other than Karate. Very, very important snake, my dear friend. As I told you, it is a neurotoxic and it will cause respiratory muscle paralysis like cobra. This is common Karate or Karate. Now, sir, there are 4 similarity, my dear friend. There are 4 similarity between scorpion and between spider. What are these 4 similarity? First similarity, both are arachnida. Both are having 8 legs. Both are neurotoxic and both causes priapism. That is scorpion and spider. For scorpion, we give anti-scorpion venom and prazosin. Here, autonomic storm is seen. What is autonomic storm? Sympathetic and parasympathetic activity both are increased. In spider, we have D, that dapsone is given along with anti-spider venin. Here, it is not anti-snake venom here. It is anti-spider or anti-scorpion venom. Prazosin is given for scorpion. Dapsone is given for spider bite. Now, sir, 30 BNS says in emergency, you can start the treatment without consent. E look like 3, no consent 0, that will be E look like 3. No consent is needed in emergency condition or in life-threatening condition. It is 30 BNS. 3 look like E, emergency. 0 consent is needed, 30 BNS. 30 BNS. Okay. A patient was referred by a doctor to radiologist for CT scan and the doctor was given money for this. That is a commission khori. My dear friend, this commission khori is known as dichotomy. That is a fee splitting of patient. So if you are giving money for referring a patient, it is a dichotomy. तो दोस्तों कुल मिला के आप दलाली कर रहे हो. This dalali is known as dichotomy, a fee splitting of the patient. A fee splitting of the patient. Now forward, vicarious liability is let master answer. Let master answer means the employer is responsible for the negligence of employee. That is a let master answer, vicarious liability. Res ipsa loquitur, if during surgery you left the swab in the body, you are responsible. Thing or fact which speaks for itself. आपने ऐसा काम किया है जिसके लिए आपकी पूरी जिम्मेदारी जाएगी. Res ipsa loquitur. Surgeon forgot the swab in the body. Thing or fact which speaks for itself. Therapeutic misadventure. Complication which are accidental, unintentional, but sometimes it happens. It is a therapeutic misadventure. Contributory negligence, where doctor and patient both are responsible for the negligence. So revise with me. Let master answer, vicarious liability. Yes. Surgeon forgot the swab in the body. That is a res ipsa loquitur. During treatment, some unintentional or accidental complication take place, therapeutic misadventure, and doctor and patient both are responsible. That will be a contributory negligence. Sir, this is cadaveric spasm, the most characteristic finding of antemortem drowning. Antemortem drowning, this is cadaveric spasm. The mechanism is ATP depletion, and it is a postmortem change, which is the most characteristic finding of antemortem drowning. You struggle in the water and there is a spasm of the muscle. That is a cadaveric spasm. It is an antemortem event. It is a antemortem event, and it gives idea about manner of death. It gives idea about manner of death, cadaveric spasm. Now, sir, as I told you, the most characteristic finding of antemortem drowning is cadaveric spasm. Most characteristic finding of antemortem burn is soot particle in trachea, that's a carbon particle. And most characteristic finding of antemortem hanging is dribbling of saliva. 3 question: antemortem drowning, cadaveric spasm, soot particle in trachea, antemortem burn, dribbling of saliva, antemortem hanging. Now, sir, you can see the dribbling of saliva. It is mostly seen on the opposite side of the knot, because like see, this is the knot, the maximum pressure will be in the opposite side of the knot. This is dribbling of saliva, the most characteristic finding of antemortem hanging. Second, la facies sympatheticae. What is la facies sympatheticae? It is on the same side of knot, eye remain open and pupil is dilated because of cervical sympathetic chain stimulation. Like see, here we have the knot, the same side of the knot, eye remain open and pupil is dilated. This is la facies sympathetica, another finding of antemortem hanging. But sir, what is dribbling of saliva? Dribbling of saliva, this is the knot, it is seen on the opposite side of the knot. La facies sympatheticae, same side of the knot, eye remain open and pupil is dilated because of cervical sympathetic chain stimulation. Now, sir, this is a very, very important change of the sclera of the eye, Teke-Neuer. Teke-Neuer. You can see some important changes. This is the change of the sclera. Teke-Neuer are seen in 3 to 6 hours after death, and it is the change of sclera. This is Teke-Neuer. Very important picture. Sir, this is the sign in the eye. What is the name of the sign? It is a Kevorkian sign, railroad phenomena or cattle trucking sign. Here, retinal vessels are fragmented. In eye, this is the earliest sign. Kevorkian sign, railroad phenomena, the retinal vessels. What is RV? Retinal vessels are fragmented or segmented. The earliest eye sign is Kevorkian sign after death. Rigor mortis, the mechanism is ATP depletion. The first muscle of the rigor mortis is myocardium. First external muscle is upper eyelid. Overall, first muscle is myocardium. First external muscle is upper eyelid. The mechanism is ATP depletion. And rigor mortis start from the head and goes towards the toe, up to down. This is a Nisten law. This is a Nisten law. Rigor mortis gives idea about time since death. Cadaveric spasm gives idea about manner of death. Rigor mortis gives idea about time since death. First muscle is myocardium. First external muscle is upper eyelid. Start from up and down, Nisten law. Very, very important. Mechanism is ATP depletion. This is marbling. The site of the marbling are chest, shoulder and abdomen. It starts in 24 hours and friends, it completes in 36 to 48 hours. It is greenish brown color due to sulfhemoglobin. This question comes in exam. The greenish brown color is because of sulfhemoglobin. This phenomena is marbling. This phenomena is marbling. Maggots are larvae of the fly, not pupa of the fly. This question comes in exam. These are the larvae of fly seen in 1 to 2 days. In rainy season, it comes very early. The study of maggot is known as entomology. The study of maggot, this branch is known as entomology. These are larvae of flies seen in 1 to 2 days. In rainy season, it comes very, very early. Friends, this is mummification. Mummification is seen in dry and hot climate. The smell of mummification is odorless. So, if the climate is dry and hot, the body gets shrunken. This is mummification. What is the smell of mummification? Odorless. As you can see, my dear friend, A for adipose here, A for ammonical smell. It is also known as saponification. The climate is warm and humid. The appearance is rancid butter. You can see A, adipose here, A, ammonical smell. Climate is warm and humid. It is rancid butter appearance. It is adipocere or saponification. Adipocere or saponification, ammonical. As you can see, in mummification, odorless, and in adipocere, ammonical, the very pungent smell, rancid butter appearance. है ना, बिल्कुल गंदा सा बटर अपीयरेंस दिखाई देगी, इसी को हम सेपोनिफिकेशन बोलते हैं. ब्रिटिश एंटील्यूसाइड इज बाल एंड माय डियर फ्रेंड इट इज आल्सो नोन एज डाइमरकैप्रोल. मैंने कुछ एग्जाम ऐसे भी देखे जिसमें ब्रिटिश एंटील्यूसाइड वर्ड नहीं आया, डाइमरकैप्रोल आया. इट एक्ट्स थ्रू, लाइक यू कैन सी, इलेक्ट्रॉन ट्रांसपोर्ट चेन कॉम्प्लेक्स नंबर 3 is inhibited. 3 electron transport chain complex number 3 is inhibited by British antilucide. It is given in intramuscular injection and almost used in all type of metallic poison, but it is contraindicated in 2 poison only. Number 1 cadmium, number 2 iron. CI contraindicated in cadmium and iron. CI contraindicated in cadmium and iron. It's a dimercaprol, British antilucide. Intramuscular it is given. Most of the metallic poison it is given. EDTA is given in lead. DMSA, very very important word. DMSA is a oral chelating agent given in lead, better than EDTA. Penicillamine it is given in copper, and desferrioxamine is given in Fe iron. EDTA in lead. DMSA is a very important oral agent of the lead. Penicillamine is given in copper. Desferrioxamine is given in iron. Now, Wernicke's encephalopathy is vitamin B1 deficiency if you are drinking alcohol very much. It is GOA, global confusion of thalmoplasia ataxia. What is Wernicke-encephalopathy? GOA, global confusion of thalmoplasia ataxia. Korsakoff psychosis, late neurological disorder due to विटामिन B1 डेफिशिएंसी. गोवा, देखो गोवा में आप दारू पीते हो तो गोवा हो गया, ठीक है. अब ड्यू टू विटामिन B1 डेफिशिएंसी गोवा क्या हुआ? ग्लोबल कंफ्यूजन ऑफ थैल्मोप्लेजिया एंड एटेक्सिया. अब गोवा में यू यूज कैप. अब आप सनलाइट में जाते हो या कुछ और करते हो तो आप कैप पहनते हो, ये भी B1 डेफिशिएंसी है. C फॉर कन्फाबुलेशन, A फॉर एमनेजिया, P फॉर पोलीन्यूरोपैथी. कन्फाबुलेशन मींस यू आर मेकिंग फॉल्स स्टोरी. तो दोस्तों ध्यान रखना, GOA is a classical triad of Wernicke's encephalopathy and CAP is a classical triad of Korsakoff psychosis. GOA, CAP, confabulation is making false story. Global confusion is Wernicke's encephalopathy. Both are due to vitamin B1 deficiency. Acute withdrawal of alcohol for 48 to 72 hours and you are having symptom of anxiety, tremor and mostly visual hallucination. That is none other than delirium tremens. D delirium, D 2 दिन, T tremens, T 3 दिन. That's a 48 to 72 hours of alcohol withdrawal. If you are taking alcohol very regularly, there will be a delirium tremens. That will be disorientation, anxiety, hallucination, and my dear friend, tremor, coarse tremor, delirium tremens. Sir, cocaine. What are the other name of cocaine? C cocaine, C crack, C coke, C she. If I am using word she, lady, white lady, and if I'm using word white, it will be snow. C cocaine, C crack, C coke, C she, white lady, lady is she, and white is snow. There is a Magnan symptom of tactile hallucination in chronic cocaine poisoning, not in acute, chronic cocaine poisoning. Antidote is amyl nitrite. Cocaine is sympathomimetic, so everything is increased BP, heart rate, and respiratory rate. The best sample is taken nasal swab. Heroin plus cocaine, he plus she is a cocaine. This combination is speedball. तो दोस्तों अगर he और she मिल जाएंगे तो बॉल की स्पीड बढ़ जाएगी. He is heroin, she is cocaine. Heroin plus cocaine is known as speedball. So cocaine, coke, crack, everything. She, white lady, and this no, all are cocaine. Now, sir, as I told you, cocaine is sympatho. Yes, my dear friend. Cocaine is sympathomimetic. Heart rate increases, blood vessel constricted, BP increase, respiratory rate, temperature increase, sweating increase, pupil dilated, and you are euphoric and excited. This is chronic. These are the feature of acute intoxication. So everything is increased. Why? Because these are sympathomimetic, cocaine. Now you can see heroin is a semi-synthetic product of opium. The chemical name of heroin is diacetylmorphine. The chasing the dragon word is used for smoking the heroin. The antidote of heroin is naloxone. So heroin is diacetylmorphine, a semi-synthetic product. It is chasing the dragon word is used when you smoke over the aluminum foil. This is heroin, and the naloxone, because heroin is a opium product, it is antidote. It is a antidote. Strychnine, my dear friends, strychnine is Nux vomica, cuchilla or dog button. Three name. Nux vomica, cuchilla, dog button. Fatal dose is 1 crushed seed. Seed are concave or convex. You can get this picture. It acts on the spinal cord anterior horn cell where it inhibits glycine on the Renshaw cell. Renshaw cell, it inhibits glycine. Glycine is an inhibitory neurotransmitter. So my dear friend, the symptom look like tetanus. Here, the most characteristic symptom is opisthotonus. That is a hyperextension of back, bow-like position. 1 crushed seed, Nux vomica, cuchilla or dog button, because it is used to kill stray dogs. It look like tetanus. It is inhibiting the anterior horn cell, that's a Renshaw cell, glycine. Concavo convex is the shape of opisthotonus. This is the seed of Rati, Abrus and rosary bead. Abrine is the main principle which act like a viper venom. So you can see the red seed, the scarlet red seed with black tip. It's a rosary bead Rati or Abrus precatorius. It is a ideal cattle poison. It is a ideal cattle poison. That is a Rati or Abrus precatorius. Semicarpus, that is a marking nut. Heart-shaped seed, Bilava or semicarpole are the active principle. You can see the heart-shaped seed, semicarpus, anacardium. Cardium is a heart-shaped seed, Bilava, or it is very, very important, semicarpus, anacardium. Bilava, null or semicarpole are the active principle. Doctor sir, if you see the blue color dot, yes, my dear friend. If you see the blue color dot in the RBC, it is basophilic stippling, which is a plumbism or Saturnism. Which is a plumbism or Saturnism. Both question comes in exam. That is in RBC. You see the blue color dot, basophilic stippling. Doctors have the seen in RBC, but the name is basophilic stippling. The name is basophilic stippling. Now, sir, Eldritch Maze line are seen in arsenic poisoning. Yes, my dear friend. As well as thallium poisoning. Eldritch Maze lines are seen in arsenic or thallium poisoning. We are coming to arsenic. AR. A. Eldritch Maze line. R. Red velvety mucosa. R. Raindrop pigmentation. A. Eldritch Maze line. R. Red velvety mucosa. R. Raindrop pigmentation. Okay. I. Iron is an antidote. That's a hydrated ferric oxide is an antidote. C. Cholera. My dear friend. Cholera, it mimics cholera. A. Eldritch Maze line. You can see the Eldritch Maze line seen in arsenic, in thallium or in chemotherapy. This is Eldritch Maze line. R. Red velvety mucosa. R. Raindrop pigmentation. I. Iron is an antidote. We use BAL. We use the chelating agent for arsenic is BAL. So BAL is used for arsenic poisoning. BAL is a dimercaprone and it mimics cholera. Antidote is ferric, this one. So my dear friend, this was all about a very, very important session, my dear friend, which is must required for NEET PG and all types of exam. So dear, go through this important slides, important images, important one-liner. Please go through this. Good luck. Goodbye.